I lead a group in the health sciences faculty, joint between the medical school and the veterinary school. We do applied health data science and AI, and we have a strong focus on infectious disease and antimicrobial resistance. So Robert just went through a bit of this, but I'm going to start by discussing a little bit our project with Philip Williams, who's a clinician who has a fellowship, an MRC fellowship with us, working with us, and Matthew Avison, and he's interested in antibiotic prescribing and how difficult it can be, and how a lot of it is done empirically, because the clinician may not even know if they have a bacterial infection, let alone if it's resistant to a particular antibiotic. And the diagnostics that are available, it will take, I don't know, you would culture a sample overnight, and you might find the ID of the particular type of bacteria, and then it might take a day or more after that to get antibiotic susceptibility test results. And this is not done for everybody, so this is perhaps done in more serious cases. And the time it takes is a bit of a problem if the patient has sepsis and you need to give them antibiotics urgently. So what we've been looking at is using the history of these antibiotic susceptibility test results to inform the current prescribing. And on the bottom left here, this is the first thing I'm going to show you is almost not AI, because it's a Bayesian model for looking at resistant rate changes over time. They can change, they can be different for all patients than patients in a specific ward. And they're different if you know that the bug is already potentially resistant to your first line antibiotic and you want to switch to another antibiotic. So we make predictions based on the history for the time of the prescription event, and then of developing dashboards that give the clinician an idea, compared to a particular antibiotic, which other antibiotics have more chance to work for this particular patient. And moving on from that, that's essentially a stratified approach. And now we're keenly working on personalized prediction using explainable artificial intelligence. So it's taking that information, but all the history of the patient themselves. And we've been doing this through Health Data Research UK. A huge amount of work by many people has enabled us to link together us and the integrated care board of our region, to link together primary care details and records from 1 million people around here with our laboratory antibiotic susceptibility tests. So this has taken an awful long time to get together. It's very complex data, and now we're at the early stages of developing these AI models. Up here, it shows, for instance, an initial look at the explainability of the AI for particular patients. What's important? What factors are important here in the prediction? Prior resistance is a particularly important one, but you can see there's also correlates with age and other things as well. And then finally, I was going to go on to just briefly introduce you to other things we do. Say we work in the veterinary sphere as well, looking at modelling and prediction that will be helpful in livestock, but also environmental surveillance. I talked before about what you can do after culturing the bacteria. You can pass it through a MALDI mass spectrometer and figure out whether it's E. coli or staph. But that's all you can really do at the moment, and we're really we've got a project looking at extending this to get antimicrobial susceptibility and toxicity direct from that mass spectra, and thus earlier. So that is with Ruth Massey, Matthew Avison and co, and there's a link there. And then for something pretty different, we also work with accelerometry, developing wearable sensors here for goats and sheep in sub-Saharan Africa. Looking at that, the changes in activity that can be correlated and predictive with, say, anthelmintic resistance to worm treatment. And in the bottom right, we have a BBSRC grant at the moment looking at tracking activity and particularly the social behaviors, social interactions between animals that can be, just like humans, the early indicators of impending infectious disease coming up, in this case, mastitis. So I'm going to leave it there. I'm very happy and keen to talk to anyone who has applications as us as data scientists can help you create solutions for. Thank you.